Cancer is very scary to hear that word. When they gave me the diagnosis, I took it as a very matter-of-fact thing, like, okay, I have cancer, let's go, what's next? Then it hits you like a ton of bricks.
We went from 2 small chairs in a clinic to this wonderful building that is now the 5th largest provider of cancer services in the United States. And it started with trying to truly understand what is it that a cancer patient needed. It's more than just the medical care. That was obvious early on. And as I watched and learned with my patients about their challenges, a few things struck me. One was the fact that this disease we call cancer is transformative. You go from being a person to the next day you're a patient. And it doesn't matter what your socioeconomic status is, it doesn't matter how powerful you are or anything else. The moment you hear the word cancer, for most people, they're scared, they're uncertain, they feel guilt, and all of these emotions. What could we do here that would be transformative?
Our team has worked really hard over the last 2 decades to develop our cancer program. And our philosophy, I would say, is to try to develop as much as possible innovative, cutting-edge care in the best environment for patients.
We came up with the concept of extraordinary care.
Any patient, when they first come for their first appointment, we will often refer them to our psychosocial advanced practice nurse. She helps with any kinds of issues related to anxiety, stress with the diagnosis, coping with the diagnosis, depression.
They make you feel safe.
So we want disease control and cure.
Right.
Yeah.
So extraordinary care has 5 components. The first is that if you have a specific type of cancer, you want to know that you're going to a group of experts. So over a 10-year period, we built teams of people that were expert in a given disease, and we call them multidisciplinary care teams, disease specific. We brought in world-class surgeons, world-class medical oncologists, researchers, radiation oncologists. So patients know when they come here, they're seeing an expert in their disease. And not just one type of expert, but every type of expert needed.
As we move forward, we would like to be able to identify signatures, genes, subset of genes, something that is expressed on the cell that will tell us about the behavior of the disease. But then what we want to do further is to evaluate that for every new therapy and integrate that as part of our clinical trial.
I am on a new clinical trial with also carfilzomib being lower dosed, dexamethasone higher dosed, and then we're also adding Revlimid. Okay, so it's a nice little cocktail that we're started, and we'll see at the end of this month how we work. And clinical trials are fabulous.
We look at the whole patient and the total care of the patient. So they may be on a research protocol, and we follow them very closely, and for any adverse events, and we see them at every visit, and we're very proactive, but so does Jay Shree and our nurse clinicians and our advanced practice nurse and our physician. We'll see them at every visit and handle the other aspects of their care as well. So we're looking at the total picture.
We're really at the cutting edge of what's new in diagnostic pathology. One of the things that we've recently set up, for instance, is a CD138 sorted myeloma panel. We've developed a way to sort the myeloma cells out and look at those cells specifically for cytogenetic abnormalities, and that has significantly increased the yield of positive cases and have allowed us to subclassify myeloma patients.
Today's my 2nd day, so I'm expecting great things.
In order to complement this clinical research platform, we have developed a tissue repository and tumor bank, which was started in 2006, and we have currently enrolled more than 2,500 patients.
So another scope of these high-quality biospecimens that we have at the tissue bank is to use them with other outside collaborators from the public sectors, the universities, and the private sectors with industry partners. And our goal is, again, to achieve personalized medicine and stratify and associate these biomarkers with clinical outcome data.
We have the help from the clinicians, the nurses, even down to the phlebotomist, to the inter-hospital courier service who allows us to obtain the specimen within 30 minutes.
So when a patient comes here, they see a multidisciplinary care team that are expert in their disease, and they know they're getting cutting-edge medicine or technology, robotics, tomotherapy, and other forms of cutting-edge technology.
I do believe as we teach junior doctors here in our program and junior faculty joining us, it's really important to emphasize that obviously the quality of the care, innovation, the science, the research, but to try to deliver it not only in a nice environment, but to try to deliver it in the most humane possible way. So it's important to have a good rapport with our patients because they are very vulnerable, but also we should be their advocate, guide again for the best treatment. And I do believe that it's the best way to do it, ethically speaking, but I do believe that it does matter in the outcome of the patient.
And so the first floor of this cancer center building has been dedicated to that. Knowledge, activity, spiritual, diet.
And it's going to be a journey. And what I like about it, not that I like having cancer, but I like that that the doctors and the nurses, and it seems like the staff, they're all on the same level. In fact, my second son said to me last night, he said, "Mom, what are you doing is talking about being in this wonderful hospital. Is something wrong with you?"
But there's nothing better in life than saving someone's life.
Okay, Charles.
Okay.
You're set.
All right.
A little bit of pressure on that so you don't get a bruise.
All right. I mean that sincerely too. It's not because I'm on camera. And I you know, when I get the surveys, I mean, I put down whatever it is. One being the best. That's always ones. You know.
Thank you.
Fantastic.
We appreciate that.
All
We really
right.
do.
Yeah.
We strive for the best we can.
It's appreciated, believe me, when you leave here, knowing that people care about you.
Thank you. Well, good.
All
We're
right, then.
happy that you're satisfied. That's what we want.
Thank you.
Go in good health.
Okay, good.
Happy Thanksgiving.
Okay, you too now.